factors that contribute to obesity, as one of my early pursuits was to help develop a laser technology that could ultimately address this disturbing trend. So I always begin the conversation off with the stats because what we ultimately see is that there is a tremendous need or demand for technologies that can help solve the epidemic that we are presently facing. And so today, according to the CDC, the Center for Disease Control, approximately 67% of North Americans are overweight or obese. And that is projected to reach 87% by 2030. And the first question that we must ask ourselves is, how is this possible in the age of technology, the age of information? We have at our fingertips supercomputers, computers that can access information from across the world. And with that type of tool, we can download applications that allow us to count calories in our foods that we're consuming, to download pedometers to estimate how many calories we're burning by walking, by jogging, running. We have applications that can, while you're jogging, tell you how many miles you've gone, how many calories you have burned in that time frame, and relate it back to previous paces during a similar run. Just the power of information is inspiring. But yet, even with this information, we are still trending towards, in a disturbing way, towards a greater number of obese and overweight individuals. And this speaks to not the lack of education, not the lack of resources, because I would argue it's the highest it's ever been in our history. What it's ultimately demonstrating is the limitation in the current philosophies of diet and exercise. What we see today, according to research, is that our motivation stems from emotional distress. So when somebody says, enough's enough, I'm dieting and exercising, there has been an emotional breaking point for that individual. They either could not fit into a certain pair of pants that they could fit into all of their life, but now they couldn't. Or a negative comment was directed their way. There are always these aspects that serve as a catalyst in driving one towards making those necessary changes. And generally, it's because there is that cosmetic or emotional element. You want to look good before the high school reunion. You want to look good for your job promotion or your wedding day. Whatever the circumstance is, that's the catalyst. And the problem with the current approach with diet and exercise is there is no specificity. And what I mean by that is essentially that when you're trying to make the changes, you want to look good for your wedding day. Generally, you want to have a nice jawline. You want to be able to fit into your dress since you were last sized in that specific dress or your tux. And ultimately, when you're not seeing the transformation in those defined areas, one becomes disheartened. They ultimately abandon that pursuit. And that's because regardless of the program, you cannot direct where on your body that fat, that material is ultimately going to come off of and be utilized. So it doesn't matter if you're doing sit-ups, push-ups, it's very difficult to direct. It's impossible to direct where that material comes from. And this is a beautiful study that highlights that. And so you're going to notice throughout the presentation there are going to be citations at the bottom, just so you can understand that the facts and information that are being disseminated derive or stem from peer-reviewed publications. So this is a study that was published in 2004 in the Journal of Metabolism that looked at weight loss and circumferential reduction, specifically of the waist, after medical treatment along with dietary intervention. Well, at the 6-month time point or evaluation period, subjects lost weight. That was statistically significant. But at 6 months, these subjects consuming medical pharmacological agents saw or reported only a 1.7-inch reduction. And so what does this mean for the person that wants to fit into a pair of pants smaller or fit into a dress or not have the pressure and tension that's around their waistline when they sit at the desk. This is an indication that for 6 months you must endure. You must deprive yourself of your favorite foods because they're generally very high in calories and high fat, high sugar content. And you must exercise. And you must take the medication on a regular basis for it to be effective. With all of this in a controlled clinical environment, subjects only lost 1.77 inches or 4.5 centimeters. That's why we see a major limitation today for the success of dietary programs. We can inform our patients to say, please, diet and exercise, you're gaining too much weight and you need to reduce your risk of comorbidities. But because of the effort necessary, with little gain, it's very hard to preserve some level of sustainability. And this article highlights that quite nicely. So why is this? Why is diet and exercise, why are they so ineffective at targeting specific areas? Well, to explain this, let's just go over some basic forms of cell communication. You have the contact form of cell communication. Basically, two cells come in contact, almost like shaking hands. That's how they're able to stimulate each other. The paracrine effect is basically one cell communicating with its neighbor. Synaptic, we obviously know that's the incorporation of neurons that use what is known as a synaptic gap. But the last form of communication is endocrine, the bottom right image. And endocrine is when hormone-producing cells, glands, release a hormone into our circulatory system. And that hormone navigates the circulatory system and binds to specific target cells. Well, this is not a direct route. This is not a fast process. This is random, sporadic, and timely. And so ultimately, this is the limitation that is diet and exercise because it operates through the endocrine form of communication. So when you're dieting and exercising, you're out with your friends, you have the courage to say, no cheesecake for me, no pint of beer for me, I'm on a diet, I'm on an exercise regimen, and you're doing all the right things. Well, what's happening is your body's saying, well, we're not getting enough calories from our diet, we're working out, so we're building muscle, we require more energy demand, it's time to release some hormones to activate the breakdown of our fat to use it for energy. So what happens is those hormones are released. Does it go to your abdominal wall? Does it go to your love handles? Does it go to your mid-back so there's no longer a pressure point around the bra area for female individuals? It doesn't. It goes where there's a sufficient blood supply, feeding a specific pocket of fat. For me personally, I lose fat first along my arms and my neck, but I keep it along my chest and my abdominal area. So I look rather disfigured for the first 3-4 weeks of diet and exercise. I wish that wasn't the case. I wish that wasn't the case. I wish that wasn't the case, but ultimately, that's how, for me, genetically, I'm designed. And so that randomness, ultimately, is what keeps this individual from burning that fat over the abdominal area, to get those defined abs, because of the random sporadic process. Now today, there are various sources in order to help aid in a direct, specific response. And this direct, specific response is coming from secondary technologies. Now the problem is there are many, many technologies that can be lumped into two basic categories. And these two basic categories essentially include skin tightening and body contouring. And what this ultimately creates is a tremendous amount of confusion. Because today, then this is just a percentage of devices that exist. And then just for background noise sake, I'm just going to mute individuals. So please use the chat feature in order to communicate any questions. I will unmute individuals at the end, but I just want to ensure that everybody has a clear sounding form of communication. So as we continue, these are the number, a percentage of devices that exist on the market that help you try to define your core area, that help assist. But the overall problem is that these technologies that are targeting your enlarged fat cell, which is the culprit, trying to shrink down that fat cell because it's expand 1,000-fold in volume, 20-fold in diameter, that there is a gross misrepresentation of their claims. A lot of these devices today are not FDA cleared or Health Canada approved for anything concerning body contouring. That in fact they're only cleared or approved to treat your wrinkles. So you can see as you're looking at technologies to help facilitate specific fat removal, specific fat processing, you're inundated with these technologies. Well, where do I go? What do I select? What's best for my patients? Because that's evidence-based medicine. What is best for my patient that needs to make dramatic improvements in their overall lifestyle for preservation of their health? But I know to get them down that road, I have to make them look better so that they can feel better. And overall, those factors are going to allow me to provide sustainable care. And so you look to the technology, you look to the internet to provide guidance. Well, you see all of these technologies promoting something. Supplements, oral solutions, other invasive procedures. And when you actually review what they're FDA cleared for, it's for wrinkles. It's for relief of pain. So when we remove these clearances, FDA and Health Canada, and leave the core clearances behind, body contouring of the waist, hips, and thighs, reduction in arm circumference, these claims that are specific to help your patients, the herd of devices dissipates. And it leaves just a few technologies left. Zerona being the most studied, the most respected, and the only technology in the world that has FDA clearances and Health Canada approval for body contouring or slimming of the waist, hips, thighs, and upper arms. No other form of therapeutic intervention in the world today has that type of clearance, whether it's pharmaceutical or technological. And the reason being is the mechanism. Zerona does not kill the fat cell. It does not harm the fat cell. It does not create a macroscopic sensation whatsoever. So what is it doing? How is it so effective at slimming the body that it has earned these accolades from the FDA and Health Canada? What Zerona is doing, it is targeting our enlarged fat cell. Our fat cell, as I mentioned earlier, expanding 1,000-fold in volume, is what causes a person to appear obese or overweight. These 30 or so billion fat cells scattered throughout the body, concentrated within specific pockets, are now expanding, like a cluster of water balloons, if you will. Filling them up with water, you can see them expand to dramatic volumes. What Zerona does, it is able to successfully target these cells, disrupt that protective barrier around the cell, which is known as a transitory pore or temporary opening. That in turn allows for the fat to now leak out of the cell and allow that cell to now return back to its lean, contracted state before the overwhelming accumulation of lipid material. And it does this not by heating the skin or not by using a thermal laser. And we're all familiar with lasers. Either we've seen them in the movies, we've watched villains try to kill the hero with a laser, or we've seen more aggressive procedures in the market, whether it's photo skin rejuvenation or some other laser-based ablation or tissue destruction. All of those lasers are using laser energy, essentially, to heat the tissue and generally to destroy it. Zerona operates completely different. Zerona is able to successfully target these enlarged fat cells, disrupt their membrane in a subtle, discrete manner. What Zerona does is it targets a specific receptor. That receptor is structurally designed to absorb specific colors of light, known as wavelengths. Well, Zerona uses the wavelength that is its peak absorption of that receptor. So what that means is There's no better way to stimulate that receptor than using a 635 nanometer wavelength. Upon stimulation of that receptor, these effects ripple throughout the cell. That's known as a secondary cascade. Basically, it's like a game of telephone in the cell. That's what a secondary cascade is. So when you're playing telephone with your friends, you whisper in one friend's ear, that person whispers in another friend's ear, and you see how the message is distorted as you work through the chain of friends. Well, what happens is, in this case, in the biological sense, you communicate by stimulating the receptor that then stimulates an enzyme. That enzyme stimulates another enzyme. That stimulates another enzyme. Until finally you have impacted enough of the cell's function that you change its overall behavior. Now, the citation in the bottom left is from Harvard University professors that outlined this mechanism after reviewing nearly 3 decades of clinical research of low-level laser therapy. And so we see here that Zerona uses that same mechanism as a low-level laser, not creating heat essentially to yield its result. And everyone on this call is actually quite familiar with this mechanism. You promote this mechanism every single day. When you prescribe an agonist drug, for instance, well, that agonist drug is there to serve one purpose. It's there to solve or resolve the medical ailment. Well, how does it do that? Well, when that person throws back the medication, consumes it with 8-ounce glass of water, it's broken down in the digestive tract and it's absorbed. Well, that molecular structure that remains travels throughout the body, seeking out a specific target. Eventually, it finds that target and it binds to it. So at the top of this image here, it says extracellular signal molecule. Well, that's a drug. And then you see the next text box that says receptor protein. That's the receptor that the drug is specifically binding to. That drug never enters the cell. It never actually goes in the cell to interact with its function. It doesn't bind to the DNA. It manipulates the cell's function by activating that one receptor. Well, now that receptor stimulates or activates a secondary cascade. And that affects something known as intracellular signaling proteins. One enzyme talks to another enzyme. That talks to another enzyme until the entire cell's function and behavior changes. This is how Zerona works. This is the agonist effect. Zerona, instead of using a molecular component like the extracellular signaling molecule, it uses light. And that light stimulates a receptor, activates that receptor, and that sends in a secondary cascade communicating throughout the cell, altering that cell's protective fatty membrane in the fat cell, breaking it down temporarily, and giving us the first time, the first technology, the first therapeutic intervention, the first time we can target a specific pocket of fat cells, release the fat so that material can be safely metabolized. And it does this in a subtle manner that does not harm the skin, does not harm adjacent cells. Now, those are bold statements. Those are really bold statements. But the good thing is that with this presentation, I will show you the studies, and you will see the citations where your peers accepted these studies as valid, of a quality necessary and worthy of publication, to show the safety profile and the mechanism of Zerona. Now, for those of you that are biochemists at heart, you probably, a few images back, and hopefully that image appears, saw that Zerona appears to be stimulating the mitochondria. Well, the first thing you're going to raise your hand and object to is, well, every single cell in the human body, and for those of you really savvy, except for the red blood cell, they all possess a mitochondria. So how are you able to single out the enlarged fat cell and not alter the skin, fibroblasts, stem cells, endothelial cells, neurons, all these other cells, these vibrant, rich collection of cells housed within the adipose tissue layer? Well, the thing is that we stimulate all those cells. There's no way to avoid it. And in fact, our body uses this mechanism. It's a form of efficiency. So let's say your body wants to release acetylcholine, for instance. Well, acetylcholine will travel through your body, neurotransmitter, through a signal. It's released across the synaptic gap. And acetylcholine will cause in your muscles specifically for them to contract. So when you're flexing, you're exercising, you're doing all those things, well, that's happening because you're specifically releasing acetylcholine to those specific cells. What happens if you release acetylcholine into smooth muscle? You get contraction? No. You do not get contraction. You get the opposite response. You get relaxation. And that's because our cells are designed in very specific ways to serve very specific functions. So, and I apologize for jumping back, but when we jump back to this image here, the extracellular signaling molecule, some receptors are what are known as ubiquitously expressed. Well, what does ubiquitously expressed mean? Well, that means they're found on many, many different cells. And so when you release a hormone that binds to a specific receptor that's found on many, many different cells, well, you may not want a reaction in one cell. So what does your body have in place? Well, the makeup of cells will ultimately result in a different response, the intracellular signaling proteins. So upon activation of the receptor protein, that may activate a different intracellular signaling enzyme or protein in one cell, and it may activate a completely different one in another cell. And so what you see in this image on the far right here is that there are many bifurcations, many divisions in the process of introducing a stimuli and finalizing with an ultimate response. Why does this stimuli veer left? Why does it veer left here? At this point, why does it veer right? And hopefully everybody's seeing my mouse. I can always bring out the spot here. So why is this first juncture, does it go left? Why not right? Why does it go left here? And ultimately the stimuli we see, it ends out at this pathway. Well, that's because basically what happens is we have this stimulation, and if we go to this left image here, it says uncatalyzed. This is referring to a reaction that's catalyzed. Reactions are catalyzed by an enzyme. So depending on the enzyme, why doesn't door 4 open? Why doesn't door 3 open? Why doesn't door 2 open? It depends on a lot of different aspects being present. And so what happens ultimately is that the fat cell has its unique makeup. And so upon stimulation of that photoreceptor, upon activation of that secondary cascade, we see a reaction that is unique and that is specific to the fat cell. And that is what allows us to affect the fat cell, but yet preserve the viability of adjacent cells. So Zerona, in turn, using a very specific wavelength, activates a receptor, a photoreceptor. Upon activation, affects certain cascades within the fat cell that, this is an image from one of our studies, shows the breakdown of the fat cell's protective outer barrier. So this animation shows that upon stimulation of that mitochondria, specifically via stimulation of the photoreceptor, we activate a specific component that begins to break down the protective barrier of the cell, creating the transitory pores, or those temporary openings. Now, a study at the University of Chicago asked the question, what happens when you create the pore? Does it kill the cell? Does the fat release? What are the overall outcomes? So this study, and allow me to set up the image for you. So overall what we see is this upper left corner here. You can barely make out, but it says T 0 minutes. These are fat cells that are enlarged, not yet treated. Now the bottom right corner here, you can see T, representing time at 120 minutes. These are incubated control samples, exposed to no other elements than the environment, no laser. And what the takeaway is when we compare this sample here with the pre-procedure sample, structural integrity maintained, volume maintained. Now, when we introduce Zerona, what do we see? We see ultimately at T 15 minutes the early stages of that fat cell membrane breakdown. When we go back and look at the fat cells 30 minutes later, we see that now the fat that has been accumulated inside of those cells are now, that fat's now beginning to leak out of the cell. And so finally, when we come back in and look at the cell 60 minutes later and compare that to the control sample, what do we see? We specifically see a dramatic difference in volume and the structural integrity, which was lost in the treatment group. And why is that? 95% of the fat cell's volume comes from the accumulated lipid material. So what do? Zerona, by disrupting its membrane in a subtle fashion, allows for the aspect contributing to 95% of the volume to actually release from the cell. And so we get, overall, we get collapsed fat cells. Moving on, the next study, and whenever we do clinical trials, we work in a series. We work in logical steps. We don't want to say, oh, in a petri dish, it deflates some fat cells. Let's start treating 24 people. No, we want to say, okay, the next question. How does it affect fat cells that are protected by a skin barrier? So we took, in an ex vivo study, we took live tissue from the abdominoplasty section, divide it into a control group, treatment group, treat it with a modified Zerona, and what do we see afterwards? We ultimately see the control sample that did not receive treatment, fat cells remained enlarged. The treated sample, however, we see that even with an intact skin barrier, when we went in to look at the fat, what this indicates is that laser was able to penetrate through the skin, reach the subdermal fat layer, and ultimately result in the fat cells collapse. So confirming that we're actually quite able or capable of penetrating the skin to reach the fat layer. The next study. Let's look at the fat cell from a 3D perspective. This is something known as scanning electron microscopy. Scanning electron microscopy specifically allows us to look at the fat cell from a three-dimensional perspective. So over here on the far left image, we see pre-treated samples, large, voluminous cluster of grapes again. That's essentially what happens when the cell fills up with fatty material. And now after we treat with Zerona, and then with an intact skin barrier still, we go in and look at the fat, we no longer see the defined parameters. That's because Zerona, again, permeated the skin, affected the biochemistry of the fat cell, and resulted in the release of fat, as highlighted by the red arrows. We can see little lipid droplets, and I'm just dotting them when I see them, little lipid droplets forming on the outside of the membrane. That's because the transitory pore, or that opening, allowed for the fat to leak out. And the once defined shape or structure of the fat cell is no longer evident. And finally, when we look at other pockets that receive treatment, all the fat cells have completely deflated or collapsed in. Powerful indication that Zerona, again, is affecting the very volume of the fat cell. And that, in turn, is giving us our slimming event. And so this image here, in vivo adipocyte, this was a part of the peer-reviewed publication. You can see the citation at the bottom. But this also assessed the effect on fat cells, but then went in and looked at other structures. Well, what happens to the vasculature? What happens to my stem cells? What happens to my blood vessel? Well, we were able, as highlighted here by the blue arrows, to identify specific pieces of blood vessel or segments of blood vessel and monitor their integrity. And we looked at other cells, and what we were able to identify in this peer-reviewed publication, accepted in Plastic and Reconstructive Surgery Journal, we were able to show that only the fat cells affected in this ill manner, collapsing, deflating, but the blood vessels and adjacent cells remained intact and viable. The final study that we're going to talk about is a study that highlighted quite nicely, or beautifully I should mention, the depth of penetration. So essentially what we utilized was magnetic resonance imaging to secure T1 and T2 sequences. So what does T2 sequences specifically get us? Well, this is the subcutaneous fat pocket. Down here is the X's indicate the buttocks. We're looking at here's the iliac crest. iliac crest left, iliac crest right. So this little pocket of fat right here, or this section, is the subcutaneous fat of the belly. And what do we see that looks rather unique in that area? Well, what we see is that it's rather chaotic. It's referred to as heterogenic. Well, here we see a unique pattern right there. Here's another unique pattern, another unique pattern. What this indicates is that across the entire tissue segment, that there's no defined pattern, because some fat cells are larger than others over here, other fat cells are smaller over there, so it's heterogenic, rather chaotic. So what happens when we introduce Zerona in this live subject and look at the tissue quality after? Well, the subcutaneous fat, its overall structure and appearance dramatically changes. There are no longer segments, no longer portions that can be differentiated from other segments or portions. That's because the fat cell, again, was successfully treated in a subtle approach, resulting in the formation of that pore and subsequent release of the fat, so that that material has now been drained of the cell. And so what happens? The enlarged fat cells in chaotic pattern, completely lost. And so that is an indication overall that we're able to, and for the individual that just joined us, thank you very much. Ultimately, I just put you on mute for quality assurance and quality of sound. But if you do have any questions, please use the chat feature, and thank you for joining us. So ultimately, as we get back to our conversation, the tissue confirmed by radiologists and plastic surgeons showed that Zerona had a depth of penetration down to 4.5 centimeters, affecting subcutaneous fat. Now, for those of you on the call, you're thinking, whoa, what if somebody has a fat pocket that's only 1.0 centimeters? Do you affect organ tissue? Well, no. Underneath the subcutaneous fat layer is skeletal muscle. And skeletal muscle contains a rich collection of mitochondria, as well as a rich collection of hemoglobin, which is in and of itself a structural entity that absorbs light. So there's no way for laser energy to traverse and penetrate beyond the skeletal muscle layers. We're only successfully able to treat directly subcutaneous fat. So there are no concerns if somebody has a smaller fat pocket, if this laser is penetrating down to 4.5 centimeters. What it does indicate is that for somebody that is obese, that needs this treatment more than anybody, regardless of that fat thickness, we're going to at least get down to 4.5 centimeters in one treatment. So overall, in summation, before we get into the in vivo studies and the clinical data, Zerona stimulates a photoreceptor. Upon activation of that photoreceptor in an agonist drug-like mechanism, we create a transitory pore. That pore is the avenue in which the stored fatty material safely exits the cell, and that cell ultimately collapses. We do this without harming or destroying the fat cell, and we're very proud of this fact because the fat cell is an endocrine organ. That title on the right there, Molecular and Cellular Endocrinology, that speaks volumes. Adipose tissue as an endocrine organ. This article discusses, with over 200 citations, how the fat cell helps preserve a balance of energy, helps maintain insulin sensitivity, blood coagulation, so on and so forth. So we don't want to destroy this cell. What in turn we want to do with Zerona is get it back to a safe and healthy size so that we can preserve all of these positive benefits of the cell. So the question that, of course, is on everyone's mind now is, okay, you've articulated to us how you get the fat out of the cell. Where does the fat go? Is there a risk of fatty emboli? Does it go into our circulatory system? Is there an elevation of triglyceride levels? So on and so forth. Well, essentially what we observed in our studies, and I'll show you the data right after this slide, is that we are very similar or use a mechanism analogous to natural fat metabolism. So throughout the day, your body needs to use X% of fat to drive your basic function. Keep your heart beating, allow your muscles to contract, so on and so forth. So your body has to release certain hormones that go to fat cells, activate the fat cells to release the fatty material from the cell. And it has to do that because we store fat as a triglyceride. And in order for that fat to actually leave the cell, it needs to be broken down into a free fatty acid. So it needs hormones to activate this. So once we get that activated, finally the free fatty acids enter into our blood system, absorbed by tissue so that it can be further broken down and released ultimately as carbon dioxide, CO2. Well, this is natural fat metabolism known as lipolysis. If you want a detailed explanation, just simply look it up in your biomedical textbook and it'll map out the mechanism in great detail. We can also connect offline. I can send some articles describing lipolysis. But Zerona deviates from lipolysis, or the pathway of lipolysis, in just one step. See, we don't wait for the body to release the hormones to finally permeate a specific pocket of fat to release the fat as a free fatty acid so that you could finally metabolize it. That, again, is the limiting factor that results in dietary and exercise failure. Because that process, again, endocrine communication, random, sporadic, doesn't mean it's going from, it doesn't mean it's activating a fat pocket that you want or your patients want to have activated. So what does Zerona do? Well, it bypasses that complex biochemistry. Instead, it forces the release of triglycerides by creating the pore. Now, remember, we don't disrupt adjacent vasculature. We don't disrupt blood vessels. So there's no ability for that triglyceride to enter into the circulatory system. Hence, no risk of fatty emboli. So where does the fat go? Well, the fat is now removed by the lymphatic system, which regulates the space outside of the cell. And inside the lymphatic system is an enzyme known as lysosomal acid lipase that actually breaks down triglycerides into free fatty acids. So what that means for us is that by the time the Zerona-released lipids enter the circulatory system, it's in a safe free fatty acid form. The same form that our bodies use, probably using right now, in order to produce energy. How did we confirm all of this? Well, we did a study looking at fasting lipid panels. We needed to ensure to FDA and Health Canada that at no point in time that there was an elevation in a subject's blood chemistry, meaning no elevation in triglyceride levels, no elevation in cholesterol levels, no elevation in LDL levels. In fact, this publication showed the opposite. It had opposing outcomes, that there was a statistically significant reduction in serum triglyceride, cholesterol, and LDL levels. Now, this doesn't mean that we're promoting Zerona as a means to reduce cholesterol. What this is showing or validating is the mechanism of Zerona, that the fat is safely broken down before entering into your circulatory system. That there is no risk of elevation or fatty emboli because triglycerides are not going up, cholesterol levels are not going up. Hence, this is indicating or highlighting the safety profile of the device. Now, with this information showing that we're not going to alter one's blood chemistry, that we can effectively penetrate the skin and collapse and deflate fat cells, do we have a slimming technology? Without diet and exercise, can Zerona actually be beneficial? So what did we do? We performed a placebo-controlled, randomized, double-blind, multi-centered study. Subjects had no idea what group they were allocated to. They didn't know if they were getting real laser treatment or fake flashlight treatment. The device looked the same, sounded the same, felt the same. They actually had a rich red glow dancing along their treatment area, but it wasn't therapeutic. It was just a good way to preserve the placebo effect. Additionally, subjects had to keep a daily dietary journal. Why was this important? Well, we didn't want subjects saying, well, I'm in a fat slimming study, I'm going to make the best of this, and I'm going to go out and I'm going to stop eating McDonald's, I'm going to start eating Subway. I'm going to stop drinking wine and start drinking water. What does that do? That introduces a confounding variable into our equation. So we don't know whether it's their lifestyle change or Zerona that's effective. So all subjects had to keep a daily dietary journal recording calories consumed and any participation in physical activity. Because if we saw a deviation from their normal lifestyle, we were required to excuse this individual from the study. Now, the study included 6 treatments every other day for just 2 weeks. So that means subjects came in, got a treatment on Monday, Wednesday, Friday of one week and received treatments on Monday, Wednesday, Friday the following week. Each treatment stimulated at the same time waist, hips, and thighs for 40 total minutes. 20 minutes on the front, 20 minutes on the back. So once the technician or study coordinator set up the device, he or she left the room, patient received 20 minutes of anterior stimulation, flipped over, received 20 minutes of posterior stimulation. So to reiterate, no diet, no exercise, no other adjunctive modalities, 2 weeks of treatment every other day, 40 minutes each treatment. What did we demonstrate in this study, which was eventually peer-reviewed, published in the highly regarded Lasers in Surgery and Medicine journal? Well, what we found at the end of 2 weeks, after the last Zerona treatment, test subjects receiving the real laser lost 3.52 inches combined off their waist, hips, and thighs. The control group lost a combined 0.68 inches. Well, there's your placebo effect. The mind wailed away 0.68 inches. What does this mean across each area? The hips, they lost 1 inch in the treatment group, only 0.2 inches in the control group. 0.9 inches in the treatment group for waist, 0.25 for sham, and 1.5 inches on the thighs compared to 0.2. Each anatomical area showed a statistically significant difference. Again, with the people still eating McDonald's, still drinking wine, doing all the bad things. Okay, so does this result actually mean anything to anybody? Does 3.52 inches collectively off these areas, does that actually change their motivation? Can they see or feel the difference? Before subjects were informed of their group assignment, we had them complete a satisfaction questionnaire. Are you satisfied, dissatisfied with your new body? 97% of test group subjects receiving the real laser were satisfied or very satisfied, or neutral, with 70% of them very satisfied. 3% were dissatisfied with their new body after 2 weeks. How did the control group shape up? An overwhelming majority of control subjects were dissatisfied or very dissatisfied with their new body, for obvious reasons. We had them, in addition to filling out the blanket survey, include comments. Why do you feel this way? Well, test subjects had very positive comments. Clothes were fitting better. People were commenting. My abdomen feels like it's tightening. I feel like I'm losing weight. These are actual quotes from the FDA and Health Canada clinical study. So not only was there an objective difference that was significant, there was an objective difference, but a subjective difference was significant. Now, we have participated or organized or implemented many studies since that FDA study. And that FDA study and Health Canada study ultimately allowed us to receive the first ever clearance for slimming of the waist, hips, and thighs. Since then, in 2012, a peer-reviewed publication evaluated 689 subjects. That's a nice size population. That study looked at treatment of the waist, hips, and thighs specifically, but also looked at the measurement points of non-treated areas. Because the last thing that we want to see is that we slim down a person's waist, hips, and thighs, but they get fatty arms, fatty jawline, or fatty neck, fatty knees. So we treated waist, hips, and thighs for 2 weeks, same program as the FDA study, but we took measurements along their neck, along the subject's breast, knees, and arms. And what we found was that there was, in fact, no circumferential gain. Let me repeat that. No circumferential gain in the non-treated regions, which would indicate if there was a gain, fat redistribution was a consequence following a Zerona treatment. In fact, this study across 689 subjects reported a reduction across these areas. That brought the total loss for that subject after 2 weeks to 5.17 inches. Now, why are we getting a result if we're not treating areas? Well, this speaks to the endocrine function of the fat cell, and that's another conversation offline because that does require rather an extensive bit of detail. There was another study just published this year in 2013 Lasers in Surgery and Medicine, Volume 45. It was a physician-led study. This physician, not financially associated at all, and the previous study was, again, the same. The previous study before that, all financially independent physicians. This subject took her 86 patients, or this physician took her 86 patients and analyzed the data. She saw, when looking at waist, hips, and thighs only, without diet and exercise, that subjects were losing consistently 2.99 inches. When she added one more measurement point at the mid-abdomen point, subjects were losing 4.42 inches. So overall, she reported a statistically significant difference. So this is shown, and this is a very important element of evidence-based medicine. You have your controlled clinical trials. So the inclusion and exclusion criteria in those studies reads like a novel. 50 different points, nobody with diabetes, nobody taking antidepressants, nobody that's postmenopausal, nobody with polycystic ovarian syndrome, on and on and on. So that's a clinical environment, and you produce a result in that environment. Well, it is imperative for physician-led studies to follow, because the protocol and the inclusion-exclusion criteria, for one, is more lax. Essentially, you can enroll individuals with comorbidities. You don't have as a robust inclusion-exclusion criteria as the initial FDA clinical study. And so what this is showing is that there's duplication, correct that, replication in the results concerning the application of Zerona. Now, this was another clinical study that looked at the effects of upper arms and found a statistically significant change of the upper arms. And this study ultimately allowed for the technology to be approved for slimming of the upper arms. So this was, again, a placebo-controlled, randomized, double-blind, multi-centered study that combined objective and subjective analysis, no other adjunctive modalities used. And test group subjects lost 3.7 centimeters in their arms compared to the control group that received fake laser treatment that only lost 0.2 centimeters. Now, with all of these studies combined, not a single adverse event has been reported. There are no harmful effects shown on the fat cell when we look at them individually. There's no harmful effects on any other tissue structures, and we've been studying this application for 12 years now. So overall, it has a very clean safety profile, which is very important to have. These are just some demonstrative images on how the device can be positioned. This is the protocol that was used in the FDA and Health Canada study. What we're seeing, essentially, is that there's a center diode. There are now lateral or adjacent diodes. These diodes are treating the lateral portions. The center diode's treating the midline. And then we have collateral diodes. So here we're treating the waist only with this diode. Here we're treating the lateral thigh. Here we're treating the collateral portion over on the other adjacent side, and we're treating midline. So we can target waist, hips, and thighs. Now, for individuals that want more of a specific treatment and a greater reduction, we can tailor the treatment to target individuals' desired areas or where you feel the most benefit will stem from. So these diodes are flexible. They can be conformed in a manner that allows us to cross them, and we can target this person's left flank for 20 minutes, flip them over, and target their lateral or collateral right flank for the additional 20 minutes. We can cross the diodes, again, in another position that's more comfortable for the patient, so that we can focus on this individual's midsection, so that we lose a greater amount of inches here, and we have now a focused treatment. So this goes back to our very initial point. Diet and exercise fails to be specific. Regardless of how many sit-ups she does, that does not mean she's going to burn fat there first and at the greatest rate. So what we have seen is that your body will use a certain amount of fat in that 2-week time frame without diet or exercise when Zerona releases the fat. Why? Because it's saving the body the step of releasing hormones to mine procure the fat to process it. We're giving the body free fatty acids to process and metabolize that. And so we're able now to specifically target these areas so that the body preferentially uses that fat above and beyond any other pockets to feed its natural metabolism. Just here's the inner thigh treatment, upper arm treatment, combined technologies. So before and after images, I'm not going to get into the before and after images because that's subjective, and I feel that we've done a fairly decent job talking about the data. But these are images that you can speak with a sales consultant about to acquire more images, to learn more about the result, what that means. But if you want to read from a peer-reviewed published article, if you want to digest that information from an article that has been accepted by your peers, worthy of publication, then I'm more than happy to provide you with those articles so that you can understand that before and after images like these stem from these types of publications. These are from an article in Italy, a physician images from an article published in Italy. This is from an article that was published here in the United States. So these images are under a very controlled environment. Now, moving on in our conversation very quickly as we wind down here for time, and I'm going to leave some portion of time for questions. Do we have to stick with the 2-week protocol? What if I have a patient that's a 33 BMI? Can I help that person? Absolutely. The difference is you no longer are offering that person a 2-week protocol. You now say, for me to have truly a profound impact on your contour, for you to truly appreciate the results, I need to provide you with a 3-week or 12-week or 20-week or 40-week program. Whatever the goal of that person is, you can accommodate by designing a package that allows that person to treat more fat. Now, how is that possible? Well, remember, we get deep. We penetrate down to 4.5 centimeters. So all those cells collapse. What happens to the next treatment? Well, if the volume has collapsed slightly, what does that mean? We get deeper. Zerona penetrates deeper and deeper and deeper as we move on from treatment to treatment to treatment. So over time, if the person has enough fatty material to warrant a 38 treatment session, then we're going to be getting deeper and deeper and deeper each session, so that at the end of the 38 treatments, we have hopefully saturated all adipocytes or fat cells in the targeted area so that we have provided her a profound change. There are results within Zerona Canada today that are in excess of 80 inches. Astounding, unbelievable, life-changing results. That's the power of the technology when you target an area and you motivate the patient because they're seeing the differences in 2 weeks. They're seeing the change, profound change, that puts them in a mindset that says, I'm not here to achieve something. Zerona is helping me achieve something. I have the greatest ally, the greatest reinforcing agent possible. I need to maintain now what this device is helping me achieve. I'm now fitting into a pair of pants 2 sizes smaller. That's empowering to say, what do I need to do to maintain that now? And those decisions, do I eat the cheesecake? Do I have the mocha venti frappuccino that's loaded with sugar and calories? Or do I just get the black coffee for my stimulant? Those are changes and decisions that will ultimately be made when you have that motivation. And when you're achieving results like this in 2 weeks, this young lady fitting into her favorite pair of jeans, no longer will she feel the pressure, the pain, the irritation, the redness. No longer does she look at the 5 o'clock hour after work in hopes of ripping off those jeans because she can finally relieve the pressure. Because in 2 weeks she was fitting comfortably into those jeans. So that's a reminder every day when she's faced with a temptation or a decision. That's right, I don't feel the pressure. I don't feel the pain. I'd like to maintain that. That's a powerful transformation from our our perception. So with that being said, we have 4 minutes remaining in our conversation. I would like to unmute everybody and open up the conversation. Now, I will mute you immediately if there's a tremendous amount of background noise, so please understand that if there is background noise, go ahead and take off the, try to remove that as best as possible. So with that being said, I have one question that came in through chat, and I would prefer the chat feature, so please, that we do have a tremendous volume of participants, and it's just probably going to be rather chaotic if I unmute everybody. So we have one, how many clicks per treatment? So the question clicks, what does that mean, clicks? So this is somebody that understands the technology, has done some work to understand the technology. So every time we use a device, so let's say patient A comes in, lays on the table, 20 minutes front, 20 minutes back. Well, every time you hit the start button on that device, they will use 2 clicks. And 2 clicks is basically like, it's not credit, but it's a tracking mechanism. So those 2 credits, or those 2 clicks used, will be burned or consumed. And so what happens now is, let's say your device when it first enters your office, you have 40 clicks. And you treat enough patients so that when you call us, you say, I have 0 clicks. Well, what that means is that you can no longer use that device. This is important for us because we can help monitor your click consumption. So we, on our end, can be proactive, helping with marketing. Because if we see we load it with 40 clicks and 2 months later you're down to 32 clicks, well, what we do is we can go back in and help with understanding how we get patients to your office, how you help explain the technology, rather than a few months later saying what's happening, what's going on, how can we help. Proactive in that sense. It also allows us to monitor the use worldwide so that we can proudly say, like McDonald's does, 1 billion served. We can say 1 million treatments administered. And so that ultimately is a way to help. Now, the best response that's going to come about clicks and more of the business aspect of it is through our wonderful allies through our organization, Tabitha or Len. These are very astute individuals, apt individuals, a tremendous experience, tremendous dedication that can help go and walk you through clicks from a business standpoint. So I certainly don't want to digress and move from science to explain the click application. But the very last thing on clicks for me, when I'm looking at retrospective studies to help you secure peer-reviewed publication, I can look at another doctor and say, why don't we combine with this doctor? They've used 100 clicks. They'll have great clinical data. So this allows us to bring together retrospectively clinical data so that you can earn peer-reviewed publication on how this technology is making a difference. And we certainly want to forge those relationships to have partners from a business standpoint, but also from a research standpoint. Now, another question that was raised, what about cellulite? Well, for all of our female counterparts on this phone call here, unfortunately, cellulite is rather there. It's rather permanent. When your fat is stored vertically in vertical silos, if you will. Men, we were fortunate enough to get our fat stored in cross sections. So what does this mean? When your fat cells become enlarged or there's a lot of fibrotic tissue forming, what happens for females, your fat will shift vertically, creating dimples in the tissue. Men, we pull fat cross-sectionally now, so we don't get the dimples. So Zerona will successfully treat enlarged fat cells. Now the question is, how effective is it at fibrotic tissue? It is quite effective, but what I want everybody to understand on this call is that we are currently pursuing a clearance for cellulite. So we do not want, from an ethical standpoint, to overstep our bounds. We adhere and remain steadfast to all ethical principles. So we cannot offer any guiding principles or information regarding the efficacy of cellulite. What we can show you, however, are before and after images of individuals receiving treatment for circumferential reduction but at the same time had cellulite, and you can formulate your own opinions on whether or not that's a beneficial response. We're not going to make any suggestions because we do not have those FDA clearances or Health Canada approvals at this time. So is the result permanent? Another question that came from one of our clinicians participating. You know, permanent is a rather interesting concept. In nature, as a biochemist, the one thing that I know to be permanent and the only thing to be permanent is death. These other results, you know, even liposuction, for instance, well, you're physically extracting the fat cell. That must be permanent. That's incorrect. Actually, there are studies that have been published that look at patients 12 months later after liposuction and find that the percent fat lost after the procedure was all regained 12 months later. Some of the percentage was back in the surgical site. A majority of it, however, was in other areas. And that raises the question or concern now, well, where's that fat going to store since you physically disrupted the genetic storage site? So very quickly, let's look at this image. Let's play surgeon very quickly. If you're a surgeon and you're going to go in with your surgical pen and you're going to, oh, well, I'm going to take it from here, I'm going to take it from here. Those are exactly the areas you're going to go. And so why are these areas enlarged? Well, essentially, these areas are enlarged because that's where her body decided to store fat. So let's say you go in and you surgically disrupt that area. What happens to the overall integrity of that area? It's probably disrupted, and therefore, now the body's going to look for other areas to store fat if you don't change your lifestyle. So Zerona has data looking out 8 months, results maintained 8 months later. There's anecdotal evidence or smaller studies that look out 2 years later. The results are maintained. But in order for long-term preservation, it is important that the individual does not fill those fat cells back up. That's ultimately going to allow for preservation in the permanence of this treatment. This is a great question. So how effective if somebody has a hypothyroid condition or postmenopausal? Let's just summarize it in its broad category. Because let's lump in all basal metabolic disorders. These disorders that will impact one's basal metabolism. And when that's impacted, more specifically slowed, we see girth changes. Now, postmenopausals, not so much direct involvement. There's hormone shifts, but you know, when we see something like hypothyroid, we have alterations T3, T4 hormone, thyroid-stimulating hormone. So we see excessive girth gain. So diet and exercise is generally rather difficult because you're now trying to increase your metabolism. And you know, if you're not controlling the condition, then in turn, it's usually a very difficult endeavor. So all we ask is that there are no side effects, but we ask that the individuals taking medication, Synthroid, if their basal metabolic disorder is lowered because of hypothyroidism, or individuals postmenopausal, they're controlling that through naturopathic means or visiting their general practitioner, and they're getting treatment through dietary counseling or perhaps medical intervention. We can certainly treat those individuals because what they're trying to do is participate in an uphill battle. So the small amount of fatty material that they're mentioning or they're releasing ultimately, it's not going to come from these desired areas. It's going to be random, sporadic, and only a small portion that's being released. So what we need to do is concentrate our focus. Release all the fat as possible and allow the body to process that fat above and beyond other pockets of fatty material so that we can maximize the contouring in one particular area. So that's ultimately going to be a tremendous ally or resource for individuals. So we can certainly treat them. We have physicians that we can put you in contact with that have treated individuals with these comorbidities. Postmenopausal, the same. They need to overcome or compensate for the hormonal imbalances, and therefore the little bit of fat that they're releasing, we need to concentrate that from a specific point so that they're motivated and they're making the right lifestyle decisions, as well as reinforcing their need to take whatever form of medicine or medication that they're ultimately consuming. Now, I mentioned earlier, the side effects that no reported studies. I showed the slide that no studies reported a side effect. And these included postmenopausal patients. These included polycystic ovarian syndrome patients, hypothyroid patients. No adverse events, and it did not dampen the result because they were controlled, and Zerona was able to avoid the biochemistry of it all and get that material processed. So ultimately, they are able to see a good response regardless, and there's no risk. So there are no conditions that are necessary, no states that need to be. They just need to be in a homeostasis, a balanced state. So, for instance, one question, what is the state that they need to be in concerning with any thyroid conditions? As long as their TSH levels are stable, T3, T4. Now, I understand that medication and that condition is volatile, so it requires a lot of correction and adjustment. So you just need to ensure that they are as stable as possible before administering Zerona. Otherwise, what you see is individuals come and say, well, I'm hypothyroid. And if you decide to treat that individual without investigating, without understanding the severity, because they may need to have the thyroid excised, there may need to be more aggressive treatment because there's benign growth. I mean, there's a whole host of things that can contribute to a dysfunctional thyroid. So what you have to ensure is that all levels are stable and that all etiologies or contributing factors to the pathogenesis are ultimately addressed. So, you just can't trust that the individual, oh, I'm hypothyroid. Well, okay, let's treat you. There's going to be some effort on your part to understand why they're hypothyroid before you administer treatment. So overall, all the clinical trials showed the subjective and objective changes that were meaningful. No adverse events were reported. So as I mentioned, that included the cholesterol study that showed no elevation in LDL levels. That in turn speaks to the safety profile of the technology. So with that being said, we're 10 minutes over now. I am more than happy to address offline any questions that you may have from a scientific perspective, and Len and Tabitha will be honored and more than happy to help address any of the business questions that you have. So with that said, I do wish you a pleasant evening, and I look forward to communicating with you and working with you in the future. Thank you very much for attending and giving me your attention.